Well, thank you guys for hanging in there. I know it's a tough for a Friday morning to get people to come on out, so I appreciate you being interested in this topic. So I'm Lauren Hudak. I'm an assistant professor at Emory University in Grady. I run the sexual violence curriculum for our residents, and I'm also the violence task force co-chair for our injury center. So I care a lot about this topic. It's sometimes a tough topic because I think if you're a program that has SAEM nurses, your residents may or may not get education in this topic. So I think it's a super important thing for our residents to know how to do, and when they get out in the community, they may be charged with doing this. So it's important that we have a good content for them and a avenue for them to learn and having ongoing sort of learning throughout their career. So I have to give a shout out to some of my team members. Trisha actually was supposed to present with me, but she got subpoenaed for a sexual assault case this week, so she couldn't come out, so she's sorry. And then the rest of the team, they're actually not ED people, so the conference was tough for them to get to. So I don't have any disclosures. There's no financial things related to this that I have to disclose. So here's what we're going to talk about today. So first we're going to do an overview and how we built a multiple stakeholder model for our sexual violence curriculum and introduce our team members that help educate our residents. We modeled a flipped classroom approach given our program's very much into flipped classroom. We have the foundations curriculum headed by Kristen Moore and some other really great educators in our department. And so we modeled that approach for the sexual violence curriculum as well, which gives our learners more experience on their own so that they're more prepared for the OSCE sessions that we provide with real standardized patients to do these exams. We also have ongoing evaluation and QI processes related to our resident exams and just the SANE program in general at Grady. And we're developing an online production to use as content for both our learners and potentially other interested parties if people want to participate in that. And then I'd love to hear if you guys are developing curriculum in your institutions, what sort of things you're doing, and if there's movement for collaboration going forward. So this is our team. So you have to have the physician that's training your residents. That's me. Then we partnered with Trisha Sheridan, who's a SANE nurse, and she's in the School of Nursing, and also on the board of the Forensic Nursing SANE National Society as well. She has amazing content expertise and helps us kind of make sure our exams are up to snuff with the SANE nurses. John Patka is an ED pharmacist who has a real passion for the care of assault patients and has revolutionized our NPEP, our post-exposure prophylaxis for HIV. We used to not give anybody HIV prophylaxis when I was a resident, and then now as faculty, we're finally doing that up to standard of care. Gretchen Weiss is our GBI forensic scientist, so she works over the Georgia Bureau of Investigation, and she's the one that actually takes our kits and processes them. So she sees all the mistakes we make, and so she comes and gives tips and pitfalls and lets us know kind of what we need to do in terms of better evidence collection processes. And then also very, very importantly, we have a rape crisis advocate. So Grady is a designated rape crisis center. So Jasmine Holloway comes every year and gives us a talk about how the advocacy process works and how we can do that better for our patients. So once you kind of build your stakeholder team, it took, I've been doing this 4 years, and I think it took probably 3 to really get the team together and really ironed out together. So this really has been our linchpin group here. So with that, we take a flipped classroom approach, and so teaching residents to learn the content on their own, including they have an overview lecture, they have videos, photos, reference guides, all these things we encourage them to use before they come into our annual training session. So we used to train our interns orientation day, but we found that some of them don't feel comfortable with pelvic exams, they're not quite ready for that, so we actually do our annual OSCE session in April, so that's Sexual Violence Awareness Month, and so we had that dovetail nicely with our OSCE session. And so we give them that content ahead of time, and then they're ready by the time we do our April session. So the content is made available to them throughout residency so they can keep referencing it and improving their own education. So this is the case. We do one case all the way through. We take Julie Schaefer from her assault coming into the emergency department all the way through the exam, the advocacy process, and even legal intervention. I just put this up here so you can kind of see, we give them a case and they review it ahead of time. They're aware of it before the OSCE session so that they don't feel rushed. They kind of know what areas they need to be examining, what the forensic injuries are, what they need to be collecting so that they're not, just deer in headlights when they're starting their OSCE exam. So I won't read it to you, but it basically is a 28-year-old that got assaulted by an acquaintance, and there's certain areas within her exam that are critical. So that she got injured on her eye, her leg, and there's forensic sites that they need to be paying attention to when they look at the case. So then also the past medical we give them ahead of time, as well as what the physical exam shows, so that they're not surprised. And then our standardized patients are actually Julie Schaefer as well, so they know the case ahead of time, they're trained ahead of time, and everyone's on the same page. So the critical concepts, if you're not aware with SAEM exams, it's a medical legal exam. Most providers are familiar with the medical screening portion. We assess, we treat, document physical injuries, and then give them medications. We also refer them for HPV vaccination and hepatitis vaccination as well. So we all are kind of aware of how to do that. It's just the forensic exam piece that we make sure to really hit home with this. So of that, there's a forensic history, a head-to-toe forensic assessment, anogenital assessment, evidence preservation and collection, and photo documentation, for which we train and they do in those sessions. At Grady, we do ideally within 72 hours of the assault, and the key and most important piece is that it's trauma-informed, it's patient-centered. We focus on the comfort and the comfort of the patient, as well as the ongoing advocacy process and what their next step in their care plan needs to be. So the online content that they get ahead of time is a content lecture. They have a video reference that has lots of different pieces of the exam if they want to learn more. We also have a rape crisis advocacy guide. And then our DA that we work with actually provided us a legal reference questions of all the most commonly asked questions. So when you're inevitably subpoenaed to testify on these cases like 3 years from now, you'll at least know, what's going to be asked, or what's potentially the kind of the playbook for the prosecuting attorneys. We also give them ahead of time the simulation schedule and the overview, so there's nothing surprising to them. So some of the examples of the video clips that we have, I just wanted to play for you so you can kind of see a little bit of the content of what they get ahead of time.
Ms. Schaefer, I'll just have you step over here on this sheet, and I'll hold this sheet up for privacy and just undress completely and put on a gown when you're done.
And then, and these are our residents in the actual SAEM room where they do the exams at Grady. So
last one we collected was a DNA buccal swab. This is the oral swab. If there's any kissing or any oral assault, then this sample would also be collected. Ms. Schaefer, so the last one we did was on your cheek. This is going to be one that we're going to get your teeth and your tongue as well, and everything else in your mouth. So if you wouldn't mind taking these two swabs and then kind of brushing your teeth along the gums, and then also getting your tongue and kind of all around.
all right, and so there's lots of little clips like that where they can just go through the whole exam and be more familiar and more comfortable with actually how to collect it before they're doing it on a standardized patient. So then we send them into the OSCE, right? So the OSCE day session is a 6-hour marathon skills day where we have them come in at 7 a.m. and it's till about 1 or 1:30. We do an overview lecture where we try to kind of really seal home some of the content that they learned on their own. We also give them the kit to sort of look at all the different items, make sure they're comfortable with it. And then we go into the standardized patient exam. So we have trained faculty and SAEM chaperones that are in the room for each standardized patient encounter to help kind of, it's not just evaluative. We want them to, if there's questions or any issues that come up, we really want it to be a learning session so they can jump in if needed, but usually they're there to just make sure things are going smoothly. And they also have a co-intern that's assisting them on the exam. During that time, so that's about a 45-minute session where they're in there with the patients, we have downtime skills stations for the remainder of the portion. So we have John Packa comes from pharmacy, talks about the MPET process. Jasmine comes and does the rape crisis advocacy. We try as much as possible to get a legal representative there. So we used to have Sally Butler from our Fulton County DA SVU unit come and help talk about legal aspects and testifying down the road. And then extra SAEM nurses are there to help kind of with extra questions if they have it. Gretchen from the crime lab comes and talks about the pearls and pitfalls. And then at the end of the day, I have them take the kit that they completed with the standardized patient and come and sign it out in a chain of custody sealed way with me so that they really nail home that chain of custody is very important. So this is what the Georgia kit looks like. Probably every year or so they switch to a different, we get a different manufacturer, so we have to kind of be facile with changing our skill set with different kits. And in the community, there's lots of different kits that are used as well, so we try to train them on multiple different kits, but this is the one we're using currently. So the OSCE schedule, just to give you guys an overview of what it looks like, so these are our faculty and SAEM, and then we have examiners and assistants, and they take about 45 minutes, and it's kind of just a marathon sort of day for the SPs. We usually, this was the most recent one. We had 5 standardized patients that did this, and it's including a full history and pelvic exam and all of that. So after they're done, in about a 10-minute session, the standardized patient in real time gives them feedback on, Georgia's now a big film industry area, so we have a lot of actors that serve as our SPs, and they do a great job of doing the Julie Schaefer case and give great real-time feedback to our residents. And then the faculty or SAEM member has a paper form that they filled out to make sure that they're hitting most of the high points that they need to be doing for the evidence collection as well as the overall forensic exam. So with that, we've noticed, throughout the years, we are always trying to improve what we're doing. So we've found that once the residents get out into doing the exams, we have occasional lack of SANE coverage. So a lot of time, our residents are responsible for doing these exams, depending on the funding waves of whatever's going on with the Violence Against Women Act funding. So we honestly, probably every 6 months or so, residents are the people doing the exams. So we've found that people don't feel comfortable, we're not really sure what to do, so we've made a lot of different guides for people to use for quick reference. So we had a step-by-step written guide that then evolved into a quick reference video for people to use on shift. And then this year we actually started our first quality improvement program where we're actually part of the residency's quality improvement program. So we have a resident that ideally every year will be doing quality improvement with us. So this was the quality improvement project that our residents did this last year.
Hello, my name is Jullian Beau.
And I'm Kelly Hunter.
And we're third-year residents at Grady Memorial Hospital and the Emory University System. We're making this video today to be an on-shift or quick reference to how to do a SANE exam. This is not intended to be any formal training. If needed, and for your reference, you can also see a complete overview guide online at gradymanual.com. Thank you.
And this basically just gives you a look at what the logistic problems they have.
This is the SANE card, and this is where you'll find the consent for the patient. This form is for the consent for information and for the rape exam. This other form will be for the patient reimbursement. The highlighted areas are what you need to complete, front and back.
Before you do your SANE exam, there's a couple of steps that you should complete. First of all, you want to go onto Epic and use the ED sexual assault order sheet. Under that order sheet, you can, if necessary, order any pain medication.
So I'll stop it there. Just so you see, there's so many logistical moving parts with these exams. People don't know what forms are, they don't know where the forms are, they don't know where the SANE key is. So it's one of those things ongoing. We have to have, every year we try to update this video so that we have there was a new cabinet that was made, so people don't know where things are. And so in order to kind of adjust to those needs, we annually try to update the content. So with that, we've found some future directions that we're hoping to kind of move towards. In collaboration with Trisha, Sheridan from the nursing school, we are making a production quality online module of the Julie Schaefer case, and we're going to hopefully make that available to definitely our learners. As you guys know, there's a lot of legal issues related to these exams, and externally sharing it is, for non-Georgia residents, our crime lab is very different than yours might be. So a lot of times we're not sure that the content will be, apples to apples to what your programs are needing, but obviously we'd be open to collaboration. We also noticed that we need to have joint SANE training sessions. Our nurses do, we want our nursing exams and our physicians' exams to be apples to apples and be very much comparable in providing that excellent quality care we all are able to do. Given, like we talked about, the waves of grant funding, we're always exploring options to write further funding so that we can actually get a dedicated SANE nurse program because they take excellent quality care of patients. And so obviously we know SANE nurse programs are desired and would be be a critical aspect of any rape crisis center's care. And then we're moving a little bit more towards educational scholarship with this too, and how to do more OSCEs, integrating that into the residency curriculum, and potentially collaborating with external institutions as well. So to give you a look at the production quality video that we've made, it's just a glimpse.
Hey, fascinated coming to see you. Will you tell me your name quick? Julie, I'm Trisha. I'm a SAEM nurse. Do you know what that is, or did anybody tell you I was coming? So I'm a sexual assault nurse examiner, and I'm here to take care of you. I'm a nurse, but my specialty is working with patients whose things have happened to them, whether it is assault.
And since we're limited in time, I'll just make sure, I just wanted to cut that, but you can see the quality of a production quality video compared to what we were doing, which it's great that we had the video, but honestly, I think having a production crew come in and do a full Julie Schaefer case all the way through, including like real-time pelvic exam, like on an actual person, so people can see how to use the toluene blue dye, they can learn those forensic techniques. We did, there's consent forms and all kinds of things we kind of went through with the School of Nursing to make this available and to our team. So that's our next step in this. So the take-home points I wanted to relay with you guys is, as you guys know, the sexual assault forensic exam it's a critical exam that's within our scope of practice, and our residents are maybe charged with doing this when they get out in the community. So we want to make sure they're well prepared and trained. The multiple local stakeholder trauma-informed approach is critical, and being able to know your own crime lab, know your SANE nurses and what resources you have available is very important to the care of these patients. We found that the flipped classroom pre-education approach has been really helpful in saving time in an already crammed intern schedule for these residents, and so that really let them kind of learn on their own time and be more of an adult learner focused. The OSCE Skills Day, I still think, is critical. Like being able to look at a kit and have a standardized patient that you do this exam on before you get out there and do it on a real person has been very important. And the residents have said that time and again that they definitely want to have that OSCE session always implemented. And then the ongoing quality improvement, like we talked about in education, and also making that education available to people who graduate so that they have resources when they're, again, inevitably testifying 3 years from now and they want to know, brush up on their skills has been important for us. So with that, I'll open it up to questions. And I'm not sure what you all are doing in your institutions for the SAFE exams, but I'd love to kind of hear your thoughts, or if there's any pitfalls you guys have had in your experiences, we can talk about it. Sir?
This is great. At our institution, they do have some dedicated time where they're supposed to be working with a local center that does these exams for us.
Yep.
Once they get out, depending on where the practice is going to be in themselves. So
That's true.
having experience for residents is important, and it's so hit and miss when they're designated time.
And it's so true. I feel like it's hard to get this in, and especially if you don't have a program there, or you're right, like if you're doing your medical screening exam of these patients and then sending them out to whatever rape crisis center that does them in their clinic, yeah, they're missing that, and they may not be able to kind of know what to do when they're out there and they don't have that. And so, and what I would suggest in that case is the online education modules might be something that would be an avenue to help augment that education. Yeah, so we can. Yeah, great, for sure, if you want to, yeah, absolutely, yeah. Yeah, exactly, good things happen, I know. Sir?
So, when you're in a jurisdiction where you have the same versus the audience versus in the region, like where we are, that happens to we just call it, they take care of all this stuff. For the community-based person who doesn't have that kind of resource, especially they're not trainees anymore, they're out there for a while.
Yes.
Them?
I think there's no time that's too late. Like I think if people are, and when you're taking that community job and being aware that that's some position you could be put in is important. And so I'd probably suggest that folks that are in that position make sure that they work with their medical directors to do, there are some online training modules through the forensic nursing. They're very expensive. So it's one of those where I think our residencies sort of building something would be really useful. That's kind of a standard. That's why we're looking for that educational scholarship piece where we have something that we put together that's like here's a playbook on how to do a SANE exam if you're out in the community.
Interestingly, though, that brings up a possibility at our shop that might work here, which is that we
Yep.
We have an event that's primarily for the residents or designed for the residents' spot. Have our physicians group kick in to support bringing some of the new docs. If they didn't, granted, that's too late. They could have gotten it.
No, and it's exactly, I'm telling you though, our faculty are the same. Like our faculty come to me and say, hey, I need some training. Yeah, like Steve, he's an art, yeah. And so there's folks that don't get that in their residency program. And so being able to sort of claim that as like part of the core competencies, I think it's still not quite there. There's some folks who are still like, that is not within our scope of practice. And I'm like, but it kind of is, like, because you're going to be out in the community and have to do it. And it's an emergency service provided to these survivors. So it's important.
There's an opportunity if you're like a central tertiary care type of environment.
Yep.
You have regional community-based partners to set up like community of practice, like spoken up model where
Yeah.
you can provide those services either in real time or virtually or whatever the case may be,
Yep.
and build capacity and everything else.
Absolutely. And it's relatively simple. As long as there's a police department that hands you a kit, like you're pretty much, on to do that. So, and usually I found that that's the folks I get the most questions from are the grads that are out in the community and they're just like, I have no idea what I'm doing, help me, or the people who get subpoenaed 3 years from now and then they have lots of content questions, want to make sure they're up, they feel more comfortable.
Your team slide that you had earlier,
Yeah.
the person on the far right, advocacy,
Yes. Mm-hmm.
are they actually a rape survivor?
So they're not. They do. They have, so the Grady Rape Crisis Center has an advocacy team are basically they're people like social worker type trained people that are able to go in and kind of provide holistic, complete care for the patient from like supportive emotional therapy when they're going through the initial trauma, and then aftercare, they arrange groups with other rape survivors or sexual assault survivors, but not all of them themselves are
Probably second question for not as part of the service provision, sort of as part of your planning group for the education pieces.
Oh, yes.
For example, the better groups or the more robust groups actually have patient stakeholders.
That is a great suggestion.
Execution of the program and say, this, like, because physicians or planners may have a sense in their head. of
Yes.
what's required, but a patient would be able to say, that's not important.
I think that's a wonderful suggestion. We should definitely think about including that.
They call it experience-based co-design is the new term for this.
Yeah.
You have patients involved, whether the end consumer involved with every stage of the planning of your programming, and then
That's wonderful.
put some papers and all some things.
I had not even thought about that, and I think that is a wonderful suggestion for sure. All right. Okay. Well, thank you guys so much. And there's my contacts. If anyone needs anything, you just shoot me an email, and I'd love to chat more. Okay. Thank you so much.